Ketones provide an important energy source for the brain during A. Periods of excess carbohydrate intake. B. Prolonged fasting or low carbohydrate intake. C. High protein diets. D. Increased exercise. Which type of fatty acid is commonly found in coconut oil and used for quick energy production? A. Long-chain fatty acids. B. Medium-chain fatty acids. What is the risk of overconsumption of medium-chain fatty acids? A. Excess protein degradation. B. Muscle wasting. C. Ketoacidosis. D. Increased glucose levels. What happens when the body depletes glucose, fat, and protein stores in anorexia nervosa? A. Increased ATP production. B. Muscle hypertrophy. C. Severe muscle. Which syndrome involves accelerated degradation of carbohydrates, fats, and proteins in cancer patients? A. Tay-Sachs disease. B. Cachexia. C. X-linked adrenoleukodystrophy. D. Zellweger syndrome. In cachexia, treatments aimed at increasing appetite primarily lead to A. Fat gain. B. Muscle growth. C. Increased protein synthesis. D. Decreased fat metabolism. Enzyme replacement therapies are primarily used for A. Mitochondrial disorders. B. Lysosomal storage disorders. C. Peroxisomal disorders. D. Ketone body. What should clinicians consider when diagnosing failure to thrive in infants? A. Excessive glucose intake. B. Fatty acid metabolism disorder. C. Vitamin deficiencies. D. Excess protein consumption. In which state does the body produce ketones to sustain energy? A. Well-fed state. B. Starvation state. C. Overhydration state. D. Anabolic state. Which of the following is not a symptom of carnitine deficiency? A. Muscle fatigue. B. Seizures. C. Excess glucose production. D. Fat accumulation. What happens to long-chain fatty acids that cannot be metabolized due to carnitine deficiency? A. They are converted into glucose. B. They accumulate in the plasma. C. They are stored in muscles. D. They are degraded in the liver. The inability to metabolize specific fatty acids in Zellweger syndrome leads to A. Increased muscle growth. B. Accumulation of toxic fatty acids. C. Decreased glucose storage. D. Enhanced protein synthesis. Which condition is characterized by the accumulation of very long-chain fatty acids? A. Gaucher's disease. B. Tay-Sachs disease. C. X-linked adrenoleukodystrophy. D. Cystic fibrosis. Which organelle is responsible for the degradation of misfolded proteins? A. Lysosomes. B. Mitochondria. C. Golgi apparatus. D. Proteasomes. In which condition does the body degrade proteins to compensate for energy loss? A. Starvation. B. Mitochondrial disorders. C. Fatty acid metabolism disorders. D. Glycogen storage disease. What happens to the brain's energy source during fasting or starvation? A. It increases glucose utilization. B. It uses ketone bodies for energy. C. It switches to amino acid metabolism. D. And cachexia, weight gain due to increased appetite mainly consists of A. Muscle mass. B. Fat. C. Water. Which enzyme is essential for long-chain fatty acids to enter the mitochondria? A. Pyruvate dehydrogenase. B. Carnitine palmitoyltransferase, CPTC, glucose-6-phosphate. D. Fatty acid synthase. What is the primary source of short-chain fatty acids in the body? A. Muscle cells. B. Gut microbiome. C. Adipose tissue. D. Liver. What happens when excessive amounts of ketones are produced in the body? A. Increased protein synthesis. B. Ketoacidosis. C. Hyperglycemia. D. Which disorder involves the accumulation of undigested lipids in cells due to enzyme deficiency? A. Gaucher's disease. B. X-linked adrenoleukodystrophy. C. Tay-Sachs disease. D. Refsum disease. Velcade is used in the treatment of A. Lysosomal storage disorders. B. Multiple myeloma. C. X-linked adrenoleukodystrophy. D. Cachexia. Multiple myeloma. Which of the following is a characteristic of medium-chain fatty acids? A. They require carnitine for mitochondrial entry. B. They are stored as triglycerides. C. They directly enter the mitochondria. In peroxisomal disorders, what accumulates due to defective fatty acid metabolism? A. Glycogen. B. Very long-chain fatty acid. C. Proteins. D. Ketones. What is a common treatment approach for lysosomal storage disorders? A. Enzyme replacement therapy. B. The failure to thrive in infants could be an indicator of which metabolic issue? A. Protein deficiency. B. Carbohydrate malabsorption. C. Fatty acid metabolism disorder. D.